Hey everyone, Dr. Kevin here over at HealthFit. And have you been dealing with some form of foot pain, whether it's in your heel, the arch, or maybe even in your toes? Some things to really take into consideration when it comes to foot pain is essentially two concepts, mobility and stability. When we look at the foot, we see that there are a lot of moving parts, 26 bones, and then also a bunch of muscles, tendons, and ligaments that kind of help keep all this together. Now when it comes to this concept of mobility versus stability, all those muscles, tendons, ligaments, and the bones have to work together to help keep your foot moving the way that it should. Now, for example, when it comes to stability, when you're walking, your foot needs to be stable enough to support all of your weight, but it also needs to be mobile enough to be able to accept that weight when you're kind of walking from a heel-toe position. If you're looking here on the ground and it goes through. There's a certain amount of movement that needs to happen, and too much of it can lead to some discomfort, or too little of it can also lead to some discomfort. When it comes to walking on hard surfaces, this whole idea again of mobility and stability comes into play, because if your foot is perhaps too immobile, then that means it's not moving enough, and therefore you're not doing enough shock absorption, the impact that it takes. However, if you're moving too much, then certain muscles are perhaps having to work a little bit harder to stabilize your foot. And both of these could lead to different issues in your foot as well. So if you're curious about whether or not your foot pain could be related to some sort of mobility issue or immobility, please give us a call, either HealthFit or leave a comment for us below. Have a good one.